During the winter, you'll hear lots about colds and the flu. Is there a difference, and does it matter? Well, the common cold is a viral infection of your upper respiratory tract, and the upper respiratory tract is just a fancy medical name for everything above the lungs. So that's your mouth, your throat, your nose, your sinuses. And this viral infection causes inflammation of the mucosa, that's the lining of these surfaces. And what that means is you'll essentially just be a bit snotty. Your nose will feel full, your sinuses might feel a bit full of mucus, and you'll get a bit of a headache. But otherwise, you'll get better over 3 to 5 days, and you might not need any treatment at all. The flu, on the other hand, is a more whole body infection. Again, it's a virus, so it doesn't need antibiotics. But you may well have a fever, your muscles may ache, you might be confined to your bed or the sofa. You'll eventually get better, and you won't need any other treatment other than paracetamol and ibuprofen. But it's a little worse. And we do know that in patients with the flu, they sometimes get other infections as well. So, there isn't really a big difference between the cold and the flu, other than the flu is worse. But there are things to look out for if you've got the flu. You do need to keep yourself hydrated. And for children especially, if the child becomes lifeless or limp or has a lot of difficulty breathing, then that does need medical review. It's important to remember, though, that both the cold and the flu can last more than 3 to 5 days. And just because this illness is lasting a bit longer doesn't necessarily mean it's going to be any worse.